Trying for a pregnancy but every month ends in a heartbreak? Hello everyone, I'm Dr. Balvin Kaur Ghai, a practicing gynecologist and IVF specialist in Tri-City, Mohali. 1 in every 6 couples globally suffers from infertility, but people fail to come forward and talk about it. What is infertility? Infertility is failure to get pregnant after a regular or a consistent effort of 1 year. Infertility is not just a female's problem. In around 40% cases, there is some degree of abnormality or some male factor involved. In India, there are a lot of couples who are facing the blame, the stress, and a lot of problems. But please come forward with your issues. So, in this series, we are going to discuss the various problems, causes, solutions related to infertility. Why women struggle to conceive? There are a lot of factors for female infertility. Today we'll discuss some of the common factors. Number 1, ovulation disorders. PCOD, raised thyroid or prolactin levels, and an overall hormonal imbalance in the body prevents the release of the egg from the ovary, which is called as ovulation. Secondly, factors related to blocked fallopian tubes. Infections or any past surgery affects the function of the tubes, resulting in infertility or an ectopic pregnancy. Endometriosis. Endometriosis is a problem that is rising, and in fact it has come to the fore very recently because of the symptoms that help the patients to identify them. Endometriosis is particles of the lining of the uterus found outside the uterus. The blood that collects there is an irritant substance which causes infertility issues by blocking the tubes, affecting the ovaries and ovulation, and causing symptoms related to pain in the pelvic part of the female. Age. It is a known factor that after the age of 35, the number and quality of eggs decreases. Certain kinds of treatments, such as cancer treatments. Cancer treatments affects the gametes or the egg formation and the count of the eggs. So if a patient is undergoing any kind of cancer treatment, it is important that they take measures to preserve their eggs or gametes. Fibroids and adenomyosis. These affect the anatomy of the uterus and the overall environment of the reproductive system, which affects fertility factors and reduces the incidence of pregnancy. Another factor is genetic or familial. Sometimes it is seen that the reproductive potential of females is limited to a particular age and it runs in the maternal side of the family. This is termed as premature ovarian failure, in which females as young as 30 to 35 years of age have a reduced ovarian reserve of eggs, and hence a natural conception becomes difficult for them. What are the treatment options for infertility? Many a times couples have this misconception that the only treatment option for infertility is IVF or something called as a test tube baby. But no. The cause of infertility, the duration since your marriage, and the various tests that help us to come to a diagnosis determine what kind of treatment is to be taken. But the most basic form of treatment can also be very successful for some of the couples. So what are the treatment options that one has? Number 1 is ovulation induction with follicular monitoring. This is the most basic form of treatment that one can take. It involves taking certain medicines, which can be in the form of tablets or injections. The aim of these medicines is for the eggs to grow. This is called as ovulation induction. The second part of the treatment is follicular monitoring. Once you have taken a medicine, it is important to see how it affects your body or what is the response of the body. So the response that we expect is growth of eggs. This can be only monitored successfully or like 100% when you are monitoring it on ultrasound. So this is something called as follicular monitoring. The second part of the treatment, or the more advanced form of treatment after ovulation induction, is something called as an IUI. IUI is Intrauterine Insemination of semen. Again, this is a very basic form of treatment in which the first part is taking medicines for the eggs to grow. The only difference from ovulation induction and IUI is that instead of having an intercourse, the semen sample is washed and prepared in a laboratory, and it is injected directly into the uterus via a catheter once we have confirmed that the egg has ruptured. The next form of treatment, which comes as the most advanced form of treatment, is something called as test tube baby or in vitro fertilization, or the exact form is ICSI, which is performed in the laboratory. This is the form of treatment which involves giving certain forms of hormones in the form of injections. The treatment usually starts from second day of period. This treatment is divided into two. One is growth of eggs and an ovum pickup. Second part is making embryos in the laboratory and transferring it back into the uterus or the womb. This combined treatment is called as IVF or ICSI treatment. This was a brief outline about the treatment options that are available. Stay tuned for more detailed videos about each one of them and the various options that one can avail of.